I will, in fairness, go to our very first questioner from way back at 2:26 p.m. So thanks for your patience, Matt. Okay, now I've just opened this to whoever you'd like to direct it to, Sam.
Yeah.
How does the Brain Cancer Centre aim to get clearer insights from the patient community?
Oh, that is a great question. How do we get clearer insights? Jim, I'm happy to, but probably Brain and others I'm thinking, plus our consumer audience.
I think there's multiple levels about how that happens. I think there is engagement in the research that's happening, involvement as consumers, as I think Misty and Toby really eloquently talked about earlier. But I think in terms of understanding also how patients respond to treatment and a better understanding at an individual patient level, I think what we're trying to do with Brain Pop, with the Brain Registry, is to collect that individual patient level data so that we can better inform cohorts of people. But I think the real hope is that we can do that at an individual level in an iterative way throughout a treatment journey. And so I think, as I said, it's multi-pronged and it's early and continuous engagement. And I think as Katja has really led from the front with the consumer body and, creating a really large group of people who inform what we do. Maybe Sarah can jump in about actually how it sometimes changes our research as well.
Thanks, Jim. And I think, this really leapfrogs on what Toby and Misty were talking about and in consumer engagement with our research. And as Jim's just instructed me, I'll give you a real-life example because we really want to discuss our research programs and our research ideas with our consumer partners, and we involve them in those discussions and really listen to them in what feedback they can give us. And in one of these situations, we had one of our consumers, Diane, who has an inoperable glioma. And we were writing a grant that was really focusing on improving surgery and 100% focused on the surgical experience. And Diane just said, well, can't we change this a little bit to impact improved treatment? Some of the things that you'll find here can enhance treatment as well. And so we were really able to expand the breadth of the grant to both include improving surgery, but also having a research arm that also focused on treatment as well. So it really can change the way that we look at our research.
Anyone else from the group? You want to add anything? Feel free.
I can add another example
if
that's helpful
go.
in terms of examples of how, feedback from consumers has changes how we work. And one of them is, for example, we might have a list of 100 targets that we could target with immunotherapy. And if I was to say, to sort of Toby or David or Gian or Penny, if we could cure a patient's brain cancer, but they would be left blind or they would be left deaf or they would actually never be able to have children, out of those, every sort of target may or may not have a different level of toxicity or side effects associated with it. So kind of hearing from a patient experience around how to triage them and how to prioritise where we make investments in target A, B and C is actually really helpful and important, informative for us.
Yeah. And I'm not sure the consumer, and I'm glad we focused on it today because it's such an insightful piece that certainly from the fundraising perspective that I have come from, now into the research world, it's such a critical part. Maybe we'll take one from the floor if there's someone who wants to jump in. No? Not at this point? Yeah, go. Oh.
It's a curiosity question. For brain metastases, in the research labs, are we dealing with the same beast or is it really something different?
So I think there's some similarities and then there's some clear differences, and I think some of the approaches will be complementary. But I think that the heterogeneity or the diversity of different cancer types and how we treat them is really the kind of the underpinning to how we want to go about and treat them. I think what we hope is that some of the pipelines we develop, particularly from sort of the discovery pipeline through to the clinic, will be useful for all different cancer subtypes. I think also historically, patients with or brain metastases are often dealt with within a single kind of disease problem, whether it's breast cancer or lung cancer. And I think now, by bringing the brain cancer in, there's also people who are really actually thinking about, well, what is unique about the brain as a site, and therefore, how we might tackle that differently as well. So I think it's an important component to our research.
Thanks, Jonathan. Anything else from the panel there? I want to thank Matt for his question as well, too, online as well. Yeah, all good. Was it Kathy? Did you have a question? Yeah.
Thank you. Directed at Jim. Jim, what are some of the key challenges that you've faced in your research career in this field, and what do you need the most help with?
So, look, apart from, we can't get around money, but I think the biggest challenges that we face that impact on time is regulation. And I think that's becoming increasingly burdensome at multiple levels of research to get everything done through to I think what you'll find from scientists and clinicians, we want to work together. We want to work with people across the road and across the world. But the sort of the legal and regulatory environment which allows us to do that is very difficult to navigate. It takes a lot of time and it's expensive. And I think if we can find better ways to kind of streamline those processes to allow us to have ethics and governance to share work, particularly at early stages where we can work together, I think that will be the biggest impact in terms of reducing the time to discovery.
Do you think that to follow on is, and to anyone, Misty, Heidi, Zach, Sarah, anyone, do you think that's something that the community would understand, that you want to work together, but there are often breaks, there are often brick walls in front of you?
I think, to be really perfectly frank, I think the community would be pretty horrified to find out that, I might want to share data sets with Raylene at the telethon, or might be able to obtain data sets from the Hudson at Monash. But whilst there is an appetite for those researchers to share those data sets with ethics and confidence in place, but we get stuck behind lawyers because the regulatory environment of who owns the intellectual property is very complicated. And so, that is one of the big barriers and challenges that we face. So we all have an appetite and we want to share and collaborate and work with each other. And I think that's sort of what entities like the Brain Cancer Centre can provide, is that umbrella, framework in which we can work and share and collaborate in a genuine partnership.
Yeah, no, well said. We have had this discussion many times, but not one brain cancer patient cares where the solve comes from. They are institutionally agnostic.
And neither do we.
No, neither do we.
And
no.
I think that's the difference.
Any other thoughts, Zach? Otherwise, we'll hold. If not, we'll go to any other. Oh, sorry, Kathy, do you want an extension of that? No? Yeah, go. And then we'll go to a couple online. Megan, after that.
Hi, I'm Marianne and I'm one of the consumers. I just wanted to ask Sarah, I really enjoyed that video, Sarah, that was great. And I just want to know what motivates you most about going back into the lab, just working labs day to day.
Yeah, I think that's a great question. I'm so excited to be in the lab, and looking at my lab team here, they know I'm not in the lab every day, but they're in the lab every day. And I'm just really excited to be part of a team that has translation at heart. So my focus has always been fundamental biology of cancer. And I initially trained in breast cancer, which, as we all know, it's very well known, it's very well funded, there's amazing research going on. And as I moved through my research career, I wanted to focus more on lower survival cancers. And I hit a point a few years ago where the importance of translation was just at its peak. And I always thought, as a fundamental biologist, I've got a good relationship with clinicians and, eventually my work will reach the clinic. And I think until working in this research environment, co-leading the lab with Jim and Saskia, and really having really that intimate relationship with the clinic, I can see that my research will one day be out there. That is what really excites me about my job.
Zach, can I get you to answer that question as well, similarly?
Sorry, about being in the lab?
Yeah. Because I see the excitement. I've just heard it from Sarah and I see it from you guys every day. It's an incredible insight into why.
Oh yeah, well, I mean, it's just really exciting. I'm in the lab. I mean,
Wouldn't be everyone's cup of tea. let's face it,
absolutely not. Absolutely not. But well, it's mine.
Yeah.
You go in, you set up an experiment, you perform it, and you get these results. And I think the thing that's really stuck with me is that you can set up an experiment, get the results, and you can be the first person ever to know something. And I think that's a really powerful thing, and that's what gets me out of bed.
Well, thank you that it does, Zach, because the experience in Sarah, we did that video and there's an hour and a half of content that that Nick, who's here today, and I really appreciate you being here, Nick, as well, who's a videographer who pulled together that 8.5 minutes worth of content. It's extraordinary, the level of detail and the level of depth. And some people have experienced it. I'm looking at Hamish and others who have had the chance to, and I think it's incredible. I would love to share more of that. That's actually what I would love to do too, because I think to provide a higher value on what these guys deliver to the community and society, we have to expose more people to their work. I think it's actually a pretty simple strategy. In practice, you can't take 1 million people through their lab, but I think there's ways that we can elevate that experience. Anything? Oh yeah, we'll do one more here and then we'll keep going. We'll go a couple from online as well. So let's do one more here and then Hamish and then up the back.
As a consumer, my question's for Toby. Did you find it intimidating working with the researchers or feel any pressure to understand the science?
That's a pretty good question, actually, because I heard someone, I think what helped, I sat in a forum not long ago where one of the other consumers who'd been there for a while said when she started, she said, I don't know anything about the science, and she was really nervous about it. But she said after a little while, she worked out that her skill set came into play and that's why they brought her in. So that's probably the reason why I'm not nervous about it now. I'm sure I'll be nervous about it when I get something wrong, but at the moment, that's probably the main reason why I'm not nervous, because I think I can bring what I know to the table.
Anything from an online perspective? Let's go to Hamish after the online ones.
There's a couple of questions about finding out eligibility for clinical trials. I've responded directly talking about the patient support aspect of the Brain Cancer Centre website. However, I think we'll get some more detailed answers up here.
Well, Jim, you touched on it, but did you about supporting teams?
Yeah, and then I might go to Heidi as well to talk about brain tumours online. We might touch that question at that point because I think that's a really important connection. So for any clinical trial or treatment, we get lots of inquiries. I'm based at the Peter Mac and can see a really great team of researchers from our Moncay team who deliver all of the brain cancer clinical trials. So it's really great to see you. Thank you. Is to speak to their treating team, speak to their oncologists, their neurosurgeons, the radiation oncologist about what their opportunities might be and to make those appropriate referrals. And I think, as I was saying earlier, to keep in touch with the Brain Cancer Centre. We're at very early stages of this program. I don't want to oversell where we're up to, but I do hope that once we get started that there'll be some exponential growth in the opportunities and the availability for trials. But at this stage where it's early days, and I think speak to your treating team and who will make the best referral and best treatment option for you. I think to talk about patient support and how to get involved with brain tumours online.
So I think you've heard all about brain tumours online, in my talk today, but how can you get involved? So if you're interested, we should be going live with our implementation and evaluation phase. As I said, it should be the end of June is what the plan is. So how we'll be rolling that out is through clinicians. So if you are a brain cancer patient or caring for someone with brain cancer who attends the Royal Melbourne Hospital or the St Vincent's Hospital or University Hospital Geelong, your clinicians should be introducing you. But there is another very important way that you can just get your hands on the website and sign up to be part of our evaluation phase and use the website, involve yourself in the community, etc. So that is by emailing. So Sarah Bray is our projects manager. I should have put this on my
we'll
slide.
Put it on
sorry.
We can put it
but
on a slide.
An email bt-online@unimelb.edu.au. I'm not sure if we can. Sounds like Sam will have it in a
I can't type that fast. Maybe Megan can. I'm not sure. But let's put it in the chat for the Slido team.
Yeah,
and
I think that's a really important thing to do because if you
Sure.
send an email and just say, look, I'm interested in this platform, when we have a date, for a specific hard date for rollout, you'll be able to, we'll send you an email and you can sign up that day and participate. So it's open to anyone affected by brain cancer patients, brain cancer, people caring for someone with brain cancer, or it's also open to clinicians. So any health professionals who are looking after or involved in the care of brain cancer patients.
Thanks, Heidi. Hamish?
Thanks, Sam. We'd like to hear some more from Zach, that fantastic work on drug repurposing. What's some of the highlights from your point of view so far with that work?
About the drug repurposing work, I guess the highlights have really just been establishing some really nice pipelines, some really detailed analyses that are robust, and we've got these targets, and the process we're working with has really found some things that I won't say maybe a little bit rogue, but certainly really interesting that sort of make sense but haven't been tried before. And I think that's really important because we don't want to just repeat the work of others that we know has already failed, and we really want to leverage this approach where we can look at combinations, because I think that's where the key point of difference is going to be compared to others, is probably unique drugs and combinations between them. I think that process, it's really setting us up to find something really nice and hopefully see this dream of taking it through the clinic. And again, it's really exciting.
Zach, forgive me. The Viagra inclusion was gold, by the way. It doesn't sound like it's that novel, drug repurposing. Do other groups do this?
Yeah, they do. And it certainly has been tried within a glioblastoma context, absolutely. But I think the point of difference is using these cells that we take and that are donated from patients and being able to grow these tumours out. That really, recapitulates what happens in the brain.
Fantastic.
And the platforms that others use just don't. And that's really a reason why we haven't seen any success stories from this sort of approach.
Fantastic. Great. We've got a couple, Sam, and then we'll come back to you. Yeah, go, Sam.
All right, thanks, guys. Just wanted to ask you about the role of technology, specifically artificial intelligence. Many of you have showed different examples of how you use technology. I mean, AI is modeled after the brain. So just wanted to ask how...
We're going to second in another resource.
All right.
So this is Dr. Saskia Freytag, a bioinformatician who co-leads a lab with Jim and Sarah, part of a tripartite lab, but is the expert in the room. So
yeah, you bang on the money. Basically,
great question.
Great question. So what Zach is talking about when he's talking about using computer-driven analysis is actually he's talking about AI, artificial intelligence. In fact, he's talking about something that's called ChemGPT. And that alludes to the fact that it's like ChatGPT, so like the large language models that you're all using probably, or maybe some of you anyway. But it does the same thing that we do with ChatGPT. So you give it prompts. In this case, you give it physical properties, and then you ask it to develop you new chemicals that have those properties or that are like already known chemicals. And then we can try these out, or we can test out what sort of, when we have combinations, what sort of physical properties these combinations might have. So yeah, watch this space, I guess. And with that, I'm going to go.
Fantastic. And I think, like everywhere in society, certainly a growing field in terms of the connection to that. We go up the back, if that's okay. And or while we're doing that, Megan, is there a really quick one online? And then Samantha.
Not sure if it's a quick one. But
okay. Let's do anyone, and then we'll go up the back.
Could anyone give some information about the importance of diet on helping to treat brain cancer or help with symptoms?
Toby, did you have any experience from a nutritional perspective? Yeah. From your personal perspective that you can offer? And or anyone else from a scientific perspective, jump in.
Yeah, I actually made the choice to go and visit a nutritionist who is heavily involved in the brain area and said, look, I don't know if there's anything I should or shouldn't be eating, but there must be supplements and stuff that'll help punch and boost the areas that I need to. So I've got a whole list of, I feel like I'm about 900 years old when I'm popping them all into those little thingos, but and I don't feel a massive difference individually, but I sleep better and it just props up all the other things that make me fight the disease a bit better. So the short answer is yes.
Where did you get that information, Toby? Did you have to find it?
I had to dig around a little bit, actually, and I got recommended to someone by someone else in the medical industry. So it wasn't, I don't know if there's an easy way to get it, but I'm happy to pass that person on to anyone else. So.
And Jim, do you want to jump in?
Yeah, I think just to jump in, because I think it's probably an understudied area and I don't think we really know. And unfortunately, most of the evidence for different nutritional supplements and other complementary therapies is not well established and can often be pushed out of proportion to the potential benefit. So I think as a clinician, as teams out, our recommendation is a normal healthy diet. Going out and juicing 10 kilos of carrots a day is not going to make a difference. But I wouldn't be surprised if there is something in nutrition that we have yet to discover. And I think it's, it's not a sexy area of research and there's not a lot of money to be made in it, so it can be difficult to focus on. But I am really interested in seeing nutrition, and I think with the other sort of side of this, I think exercise is also something that we could facilitate much more in our clinics through, maintaining bone density and physical health makes a big difference to patients' experience as well.
Yeah, sorry, definitely the healthy and the fitness stuff makes a big difference. The more exercise I do, the better I feel mentally. And I think it plays a big part that the more you let yourself lapse into sort of unhealthy practices, the more you get caught in the negative side of things and you forget the things that are going right. So the healthier you are, the more upbeat you are about things, and it just snowballs.
Well said. Let's go up the back.
My question's for Toby, but also for Heidi, from the clinician perspective. As someone who's been diagnosed with a low-grade glioma, you mentioned that you kind of had to tattoo mentally the word "ask" on your hand.
Mental, it's there.
Okay, couldn't see it from here. I'm just curious how you've managed to find a position for yourself in what seems like a very nebulous space for those with low-grade gliomas versus those with higher grade. Because the journey's longer, because the information's not as immediate or there's not a sense of urgency. What you've done to kind of not feel like an imposter in some conversations, or I think they focus a lot on the stage 3 and 4. And then Heidi, I guess, from a clinician perspective, how you treat patients and kind of advice and guidance you give them to navigate a much longer spanning journey.
From my end, it's a good question. From my end, I think I just learnt that at the start I didn't ask for help and I didn't ask questions, and I just thought I'd be given more information. And so my background is, as an architect, we have to kind of solve problems because that's the whole point of it. So I think the more I asked questions, the more I realised I didn't know something. So I got it tattooed on my fingers, which is sort of weird. But it because it's on the inside of my fingers, when I'm doing something, I see it and it reminds me, oh yeah, don't forget to ask for help, or don't forget to ask that question. So back to your original part of where do I feel like I fit in, I think I'm going to end up potentially as a 3 and 4 one day. So therefore, the more I learn about it now, the longer that time may be.
So I start this conversation when I tell someone of their diagnosis. They've had a brain surgery, so they know that there's something, they know there's probably a tumour there, but they don't know what the diagnosis is. And they come into the clinic and they find out that they've officially got a brain tumour. I always make sure to tell them that they are still them. They're still a mother or a father or a son or a daughter or a friend or whatever it is that makes them them. And all they learnt today is information. This has probably been there a while. It's probably slow growing. It's an awful, awful thing, but it does not change the essence of who they are, because sometimes it's easy to have this burden weighing on your shoulders that people carry around and it infiltrates into all parts of their life, and they forget that, or sometimes momentarily forget that they're still them. It's just this awful burden that they must carry, but it it does not change fundamentally who they are. For people with low-grade tumours especially, as you say, it's a very long journey. It is an understudied area of brain cancer because we don't currently have good models for low-grade cancer. I'm also a basic science researcher, and certainly I have a focus on low-grade glioma as well as high-grade, because I'm fortunate to have tissue donated from patients with low-grade glioma to work towards making better treatments for that group of patients. But in that first instance, I think the most important thing that I can do to support my patients is just remind them that it doesn't change who they are. It's just something that they have to deal with along the way.
Well said. Samantha, did you want to jump in? And then we'll take another couple from online. We've got about 5 minutes to go.
Yeah, I just had a question for Zach. In terms of the sort of the pipeline that you've developed, at the moment you're testing the repurposed drugs on samples, particular samples that you've grown. Can you envisage that one day you'd be able to make a model where you're getting the sample direct from a person and being able to analyse and figuring out, okay, well, this is the exact drug that this person needs?
Yes, absolutely one day. But, well, probably not me, because I wouldn't be able to prescribe a drug. But certainly, yes, that's our end goal, to be able to really use this pipeline and see, can we find drugs that target, certain aspects of tumours, certain states of tumours as well, and really use that and build that upon, and then ideally have that, as you said, we can take out a tumour, analyse it, and then be able to say, yes, I think these two combinations of drugs will be the ones that are most effective.
Is that the ultimate form of precision medicine?
Yes.
The nirvana-like state that would see us take tumour samples, analyse them.
And be able to do that, yeah. That's
amazing.
So
given
that's the vision.
This audience here will have the opportunity to ask this group questions afterwards at a drink. Is there anything else burning from online, Megan, in the last couple of minutes before we wrap up?
I had one thing to that as well.
Oh,
Sorry,
go,
just about
go.
the vision, just because it's so important, like from a drug repurposing point of view, but also linking this whole conversation we've had about linking data and sharing, is that, samples coming in from Heidi's operating room. We're doing proteomics and Sarah's doing metabolomics and Saskia's doing all the bioinformatics and spatial transcriptomics. And so linking all that data, and then Zach's screening for drugs, and, and people in my team are doing, it's just, and then bringing all that together in real time, that's the power of the BCC, right? Because then we can feed that back to Jim, who then goes back to BPOP and says, okay, so now we know what drug to give this patient. So that's the dream.
Well said. Now, I'll explain transcriptomics and metabolomics for anyone else.
But all the sciencey
See the
stuff.
passion in that? It comes out. Now, if you want to understand that, you can ask Misty straight after this. Megan?
Not a question, but a note of gratitude to you all, as it has given me hope to keep fighting. This is from Tash.
Good on you, Tash. Yeah, you're with us. Thank you, Tash.
Another one here from Anonymous. My dad has just been diagnosed with grade 4 glioblastoma. He's fit and healthy, but, and I'm sort of skipping through a little, so apologies to the questioner. I feel like I've already lost him. The personality, it's so hard. Toby touched on this earlier. Tips on how I can help him find himself again.
Oh, what an incredible question and a difficult period. Jump in, guys. Yeah.
Yeah, I think that question acknowledges something that we haven't talked about, which is sort of one of the most capricious and unfair aspects of this disease, which for some people it can change who they are, and I think that can be really difficult for family members. I think it's the most important thing when we're looking after a patient with cancer is that we look after their whole family. And so I think that's a big part of this, is for them to be connected and for their family to be supported. And I would suggest to this individual to reach out to their care coordinator from their hospital, to get involved with their social worker. And I think, whilst we don't want to talk about palliative care, I think one of the really strong messages is that our goal for people is to live well for as long as possible. and taking a holistic approach to their care, to their patients and their carers is what we need to aim for. But I acknowledge how difficult this is for that family member and watching their family go through it.
Thanks, Heidi. Thanks, Jim. Thanks, Heidi.
May I just add that we're hoping that those hard questions are something that we can help answer in people's own time and space using the Brain Tumours Online platform. People are going to have different needs and different questions at different times during the process of having a brain tumour, and some people will experience that and some people won't. And I think that would be just a plug to encourage people to engage in the platform, because they're the kind of difficult questions that you will find answers to.
Toby, while you jump in, Megan, what we might do is put the info@brain cancer email in there so that people can email us and then we can get the details for Sarah plugged into a direct conversation. Toby?
Yeah, that was something I struggle with a little bit, where it's because, as I said, they said whenever you have an operation, you come out different. And I didn't know what that was going to be like because it's grey and it's different with every single person. I watched a good friend of mine, his father passed away from a brain tumour, and he became a different person. He'd lost a lot of the emotion. He was a really lovely guy that everyone loved, and he just changed physically and mentally. And so we sort of learned to lean into the things that he really brought him joy and brought that character back out of him, rather than settle on the things that didn't anymore, because you can't really take it back. So I think what I've learned from that is try and make myself the healthiest version I can be, so that I pump up the good parts of the kid. If something goes bad, the kids remember all the good stuff and don't remember the last little bit, which might not be that fun. So all you can do is build up the memories during the time and let the last little bit just be a glimpse.
Thank you so much to this group and to everyone else, to everyone who's engaged in questions. This team have the opportunity to engage with these people immediately, so I encourage you to take that opportunity, and we'll endeavour to get back to as many questions from the online community afterwards. But can I say thank you to you as a group and wish you well.